Good afternoon, everybody. My name is Holly Standhart, and I want to welcome you to our COVID-19 call. It's vaccine acceptance or hesitancy among healthcare personnel, a panel discussion. This is part 2 of a 3-part series on COVID-19 vaccines. Additionally, if you missed last week's session on vaccination best practices and successes, this presentation is a continuation of that discussion. Again, I'm Holly Standhart. I am a Quality Improvement Advisor for Superior Health Quality Alliance, and I'm joined today by my colleague, Yvonne Burston, who is also a Quality Improvement Advisor, and she will also be co-hosting this event today as well. So before we begin, just a couple of housekeeping items that we just want to remind everybody. This presentation is being recorded, and it will be posted on our Superior Health Quality Alliance YouTube page. And then also, that'll be in a couple of days. And then additionally, after our panelist discussion, we will open the lines and the chat function for any questions that you may have. Please place your phones on mute until we open that session up. And then also, if you do have to ask a question at the end of the presentation, we do ask, again, if you could use the chat function or unmute your line, and please feel free to ask your question. And then at the end of today's presentation, we are going to ask if you could please provide some feedback on this event for today as well. So thank you. So today's objectives, we've got a couple of objectives we'd like to cover. So first, we would like to provide an open forum for our panelists and participants to discuss leadership acceptance or hesitancy around the coronavirus disease and the vaccination. And then also discuss resources on locating vaccines within your respective state. And then also provide reminders on reporting to NHSN or the National Healthcare Safety Network. So I'd like to begin by introducing our panelists. So first, we have Cassandra Fuller. She is the Regional Director of Operations. Cassandra, would you be so kind to give us a little bit of background about yourself and your organization?
Absolutely. Again, my name is Cassandra Fuller, Regional Director of Operations for WellCare Consulting and Management. I'm also a sitting administrator for one of our facilities. I have been in healthcare for 30 plus years. I like to say that I started when I was 10 years old. I have experience as a CINA, as a ward clerk, as a housekeeper, social worker. I've done admissions and marketing. Activities director. So I'm quite familiar with quite a few facets of the inner workings of a nursing home.
Fantastic. Thank you, Cassandra.
You're welcome.
Next, I have Demetrius Kirk. He is the administrator with Advantage Living Center in Southgate. Demetrius, if you want to give us a little bit of background about yourself and your facility.
Yes, my name is Demetrius Kirk, as she stated. I am the administrator for Advantage Living Center Southgate. I've been in healthcare for over 12 years at this point. I started out as a CNA, worked my way up to become an LPN and RN, and then I went back and got postmasters or master's degrees to help me become the administrator that I am today. I oversee a 100-bed facility, and I just love healthcare. I love what I do.
Fantastic. Thank you. Nice to have you here today. And then also I've got Theresa Pettyway. Teresa is the Director of Social Services at Beaconshire Nursing Center. Teresa, would you like to give a little bit of background about yourself and your organization?
Yes, hi, I'm Teresa. It's funny that me and Cassandra were talking about yesterday that I would prefer to just be called Teresa, but usually I'm called social worker, and that's okay too. I've been in healthcare for about 7 years. I always tell this story when I introduce myself as it relates to healthcare, because I have done social work in different facets of the field for over 16 years now, but I've been in healthcare for 7 years. I was kind of a disgruntled employee at my last position. I was doing foster home licensing. I was the supervisor in that, and my sister is a nurse, and she told me that I needed to come and work in a nursing home. And I said, no, I have no desire to work in a nursing home. And she's like, well, I already told the people about you, your current job, so you need to come up here. So I thought I was just coming up to fill out an application. And when I got there, it was a full-blown interview. And needless to say, I got the job, and I have been in healthcare for the last 7 years, and I truly love it. So that's a little bit about me.
Oh, fantastic. Oh, thank you so much, Teresa. Okay, so moving along here, what we're going to do is now I'm going to pass this along to Yvonne Burston, and she's going to ask you some questions about your experience with the COVID-19 vaccine. So Yvonne, take it away.
All right. Hello, everyone, and hello to our panelists. I am going to read the questions and talk to each of the panelists to give a little bit about your experience. Teresa, when it's your turn to answer, can you move closer to your mic? We could barely hear you when you answered when you talked about yourself. So I'm going to talk to Ms. Fuller first. As leadership, did your vaccination decision help to encourage staff to get vaccinated?
First, I want to start with, I forgot to mention Happy Nurses Week to all the great nurses out there.
Thank you.
Okay, so the questioning point. I think for some staff it did, not in any great number. And there were many other, concerns with that. Did I use my administrator role, my RDO role? Yes, I did, in trying to encourage people. But again, there are so many things out there, be it media especially, that social media, I should say, in all the things that's out there saying why you shouldn't take it. The government is trying to kill us. What else was out there? A couple people told me, "Oh, you're giving us the virus," and I don't think we as nursing homes did a good campaign like the hospitals did or the CDC did in general. I think we should have had something media-wise or marketing-wise to combat nursing homes and how we can get that done. Because we're a little different environment here. It's a different element.
All right, so from hearing your answer, it's safe to say that you did receive the vaccination?
I did.
Mm-hmm. Okay. And that decision didn't sway your...
I think you're going deeper. Okay, so what convinced me, in all honesty, was my husband and my grandchildren, to be honest. I had a lot of questions, and the only answers I could get was from TV, which is, what's his name, Dr. Fauci. And for me, I'm much more of a person who likes to interact. I might have question on top of question, and there was really nobody I could ask those questions to. And so I just say I took a chance. How am I doing now? Fine.
Wonderful, wonderful. Thank you so much, Ms. Fuller. Demetrius, Mr. Kirk, can you answer the question as well?
Yeah, so as leadership, did my vaccination decision help to encourage my staff to get vaccinated? 110% it did. When we booked our first initial clinic, we had 4 staff signed up. I have a staff of 67. And of those 4 staff, the day of, 3 backed out. So we had 1 staff member ready to do it. Myself, I wasn't set or convinced to get the vaccination myself, but on the day of the clinic, I had some changes of thought and changes in family's health. My dad was diagnosed with COVID. And at that point of the day of our clinic, he was at day 50 something battling COVID in a coma. So for me, I kind of just did it. And I said, if I get vaccinated, I'm going to help protect my residents. I'm going to help protect my staff. I'm going to help protect my family to never feel what I felt when my dad was in a coma. So when I kind of did that, it kind of opened up other people's eyes that Demetrius, somebody who was kind of adamant about not getting it and joking about it, he's taking it seriously and he's getting a vaccination. So as leadership, my decision definitely impacted others' decision to do it and in a good way.
And I can see that as an administrator, you choosing not to, your employees would think, well, if he's not going to take it, why should I? But then life changes had you change your mind. So
Yes.
Thank you for sharing that. Thank you. Teresa, can you answer that question as well? So when Teresa comes back, we will, because I think she's gone now, but when Teresa comes back, she's reconnecting. How about if we give her a second? I see that she's reconnecting. Okay, there you are.
Okay, can you guys hear me now?
Yes, we can.
Okay. See, okay. I just had to put my headphones on. I'll keep them on the whole time then.
Okay.
So I did have staff come and ask me about getting vaccinated. And my reason for I did not get vaccinated is because I am pregnant, and I am fortunate enough to have a father who's a physician who said that most studies are not given to pregnant women. So he advised me not to take the vaccine. But that's the only reason why. But when staff came to me and asked me about getting the vaccine, I told them that the only reason why I was not getting the vaccine was because I was pregnant. If I was not pregnant, I would be getting the vaccine. I had a lot of deaths in my family from COVID-19. I had COVID-19 myself, and I almost died. So my family members that are not pregnant, because I have a lot of family members that are pregnant right now too, they all received the vaccine. My dad's explanation to me was the death toll for COVID-19, and he had a lot of literature, so it's not like he's just reading it, getting information from social media like most people. The death toll for COVID-19 for people was about 40%. And he said that most vaccinations only have about a 10% side effect rate. So, and that's not even a death toll rate. So if COVID is taking 4 out of 10 people out of here, you might as well go ahead and get vaccinated. So my immediate family did get vaccinated. I just didn't because I am pregnant, but that was my only decision. That was my only reason for making that decision. And I did share that with the staff, and that did make them feel a little bit better.
Okay, so it didn't, that's good, Teresa. So it did not negatively affect the staff, although you chose not to.
Yes, only because I told them my reasons why. If I had have said I'm just not getting the vaccine because I don't want it, then I think that some of the staff would not have gotten the vaccine either.
Okay, especially from being a social worker, and you have, I'm assuming staff come to you quite often about
everything.
Okay. All right, great, thank you. Holly, at this time, that we want to open up for anyone to ask questions about that, or do we want to move to the next question?
Yeah, I mean, certainly if anybody does have any questions now, please feel free to unmute yourself or place your question in chat, and we'll help to address that.
All right.
It doesn't
I have a quick question for Demetrius. You had said that when you first opened up the vaccines to your staff, that there was only a few, and then there were some cancellations that ended up being one, and then you got it yourself. If you don't mind sharing, like what percentage of staff now have received it? Is it pretty high, or is it at least like you said, like 20%, or just kind of interesting?
Yeah, so we literally had 4 people sign up. At this point, I want to say we were at 48% of staff. At this current time, you still have a lot of people who, have health elements or, other things that they've heard or read on TV. My selling point to my staff now is everybody returned back to work. Everybody's here. Everybody's healthy. Nobody suffered any major side effects. The second day I made light of of me getting the shot. So I actually, it was like I used my Halloween costume. My daughter was Belle and I was the Beast. So I came to work the next day after the shot and I had the Beast gloves on, so my hands were hairy. And I said, this is the only side effect I have. If this is the worst, I'm good. So it made light of the situation and it showed the staff that, hey, there was nothing to be afraid of. All of the staff returned to work, and that actually helped us increase our acceptance rate at our second clinic that we did 28 days later.
Great question. Thank you. Great. I don't see any other questions in chat at the moment.
All right. Then we'll go to the next question. And Cassandra, we're going to start with you. Can you talk about the process and were there any parts of the process that were successful or could have been improved upon? How did the messaging and/or vaccination administration at your facility change your decision?
Okay, I guess I want to start with the successful part.
Okay.
And the successful part for us was we've had probably a good 95% of our residents are actually vaccinated. So that was good. The staff, if I can back up a little bit, it made me think a little bit more and why I don't think it was enough for just me to take the vaccine. And thinking back, my director of nursing didn't take the vaccine. My infection preventionist didn't take the vaccine. And this is healthcare. You know, I'm not clinical, if you get me. So when none of the clinicians took it, you know, that kind of hurt us a little bit. However, moving forward, we do offer the J&J. And so now all of those parties are willing to take it. And now we do have more people encouraged to do the J&J for the simple fact it is one shot. Yes, they do have questions. And it's because of the pause with the J&J. But we're trying to get that information out to them in a language that they understand. As far as the initial process with CVS, it was very difficult to encourage staff after we had 2 jump parties about it. So the first party we had to encourage, you know, ask any questions, we feed you, we gave gift cards, all of that, they canceled. Okay, no problem. They canceled a second time. So now you have people backing away, like, okay, you know, what's going on here? So they finally come, and then they're an hour late. Okay, no problem. We try to stay positive because anything can happen. But really what got me was they didn't have any equipment, meaning they didn't have the temp guns. We had to give them temp guns, pins. And at the end of the day, they took our temp guns. Can't get them back. Nobody knows where they are. So we had, you know, you have to temp every shift. So we had to run out to several CVS's to get more temp guns. But that's okay. The other thing that bothered me, well, I took it actually I didn't do the first one, I did the second. And I filled out my paperwork and I noticed they spoke about ethnicity. However, that part was shaded out and it said for employees only. So I was never even asked the question. They made the determination. I was a little uncomfortable with that. And I should have said something at the time, but I didn't. However, did I speak to a supervisor of the process later? Yes, I did. Did I care for the response? No, not really. But it is what it is. Also, they when they administered the vaccines, it was my understanding that they were going to be the ones that put it in the MICR because they administered the vaccine. So that took a while for us and the city health department working with CVS to tell them, hey, you administered the drug. You have to do the MICR. And so that finally gets done maybe 3 weeks ago, and it was done incorrectly. So now we're stuck with this incorrect information on the MICR. I think that this whole thing, I think it rolled out so fast that nobody looked at the little nuances that could occur. I don't think they spoke to people in the healthcare field at all, whether it be a hospital or at a nursing home. They might have spoke to some above the pay grade people, but not people on the ground. And when you don't do that, you're not really, getting what you need as far as process wise and how this goes. We all know it's different politics in a nursing home and different politics in a hospital. So how it could have just rolled out a lot better. What was your last part? It's kind of blocked off. Definitely changes.
How did the messaging or vaccination administration at your facility, well, we see what it did to your decision.
But it wouldn't change my decision.
Okay.
It would not change my decision to get it.
Mm-hmm.
I have a positive outcome. We only had 2 people actually, and that includes residents that actually had side effects that were notable, I guess you might say. But one person actually did have, she had to take 3 days off. But let me bring this up if I may, because I just thought about this as well. I think that it wasn't a job well done with CVS when they didn't allow us to have more dates. Because if you were part of the first, and when you get that second shot 28 days later, that's where the symptoms start. But you made a test all those people. So that could have been a lot of staff off. We just didn't have a lot of staff that took it in that time frame. And I think that's something that should have been offered.
Okay. Thank you so much. Thank you so much for sharing the process. And I thank you also for talking to the powers that be, or who you should, in regards to that. So thank you for bringing it up, but also having a solution as well. At this time, we're going to talk to Mr. Kirk. And can you answer the questions? Do you need me to read them over, or are you okay?
No, I'm okay. So our process was, when they got in the building, it was smooth. The challenge that we had is because they were trying to do so many nursing homes, so many assisted living, so many hospitals at the same time, everybody's hand was in the pot. So while I was the contact person here, I would get a call from one CVS person, and then the next day I would get a call from another CVS person confirming what the other one confirmed or unconfirming. So the process of us actually getting a date and them sticking to that date took us about 2 weeks. We were relatively early on in the trials or in the vaccination stage. I think we were January 2nd, 3rd, 4th, something along those days. So we were relatively early on once things got rolling. But just the process of having to upload all of our residents into their cloud for them to come to our facility and say, oh, we stopped using that system. Well, it took my infection control nurse a long time to load all 70 residents into the cloud, load all the staff into the cloud, because whether they took it or not, the CDC and the health departments are still tracking who has it and who hasn't had it. For them to say this system is not working for us anymore was very frustrating. Once they finally did arrive and come into the facility, we have all our own temp guns and things. So they were actually temped in. We temp our staff daily. We temp our residents twice a day. So that was already taken care of. Once they arrived, we had to accommodate their coolers that held the vials at a certain temperature. So that was extra space needed that we weren't aware of, and something that, obviously this is their first few clinics, something that they're not thinking of as well. So we did accommodate that. And as you know, these, at the time, the vials need to be kept at, I believe it was a negative 29 degrees. So we had to find something to accommodate their cooler in an area that, was easily accessible to them, but also kept the temperature where it needed to be. The process was relatively smooth because the file that they did not use, we printed it down and just gave it to them by hand because they had to physically enter it in. It wasn't confusing. We did our staff first, and then after that, we went around and did the residents room to room to try to reduce the risk of spreading any kind of COVID or infection. So we just did it in their room. It did not impact my decision to get the vaccination because, like I said, once they got here, it kind of just clicked in my head that I, once again, didn't want anybody else to suffer what I was suffering with my dad. So I think the process as they moved on, because it came out a second time and a third time, was a lot more smoother, and that may be because we were prepared for it. We knew they were going to bring a cooler. We knew they needed X amount of tables. We knew they needed X amount of space. You know, when you're looking at doing any kind of clinic, pre-COVID, people just sit where they sit. Well, post-COVID, everybody has to be 6 feet apart. You know, they're riding in the same car together, but they're 6 feet apart at the table. So it's things you don't think about, and some things make sense, some things don't. But once again, you're riding in the same car with masks off. You get in the building, it's like I can't sit next to them. So these are things that, you know, we didn't think about at our first clinic, but we built. And by the time we had our third clinic, we were fully prepared. Everything went quick and seamless.
All right, thank you so much, Mr. Kirk, for sharing that. Now, Teresa, I know that you're, with you being a social worker, can you talk about, as a social worker, the process and how it worked with you, your hand in what needed to be done in the process?
Well, I had to help them run the clinic because it would have been mass chaos outside of that. So basically, like Demetrius, I agree with him as far as the paperwork. We got all the paperwork together ahead of time and we had everything down there. But because they weren't so timely and they need to ask the residents questions, we couldn't like leave them there or try to go get someone else. So we kind of had them, you know, lined up waiting, and it's already anxious. You know, the residents are already feeling anxious to get the vaccine and anxious if they're going to have any side effects. So they were trying to like rush us a little bit when it came to like sitting the resident down and having their paperwork together and ready, asking them questions that basically I had to answer most of the questions, or the nurse had to answer most of the questions. So that kind of made the residents feel uneasy because we told them that we had everything together, you know, before CVS came. And then our other problem is that if someone left out of there to get another resident, they gave them their vaccination cards, and we had a hard time when it was time for their second shot locating the cards. So that was our biggest thing. And now I think we may have most of the cards now, but it was kind of crazy with the first clinic that they gave most of the residents their cards, although we asked them to, you know, just leave them on the table or give them to one of us to take their cards, because we have to keep track of their vaccination. And then also, I feel like this is a nursing home, and even if the people look more alert than they are, some of them may not be. I feel like the staff was kind of short with some of the residents, and I felt like this was like really serious. So if they did have questions, they should have been available to answer their questions. And so was the staff. If I wasn't in there to answer some of the staff questions, and I don't have all the answers, and I was just asking them, but some of the staff feel intimidated to ask like professionals certain things. So they want to ask you. So it's, you know, kind of just being a liaison. And I feel like they should have been more available to answer some of the questions that the staff had, and been a little bit more patient with the paperwork, because they like, oh, the paperwork should have been done ahead of time. Not for the staff. We gave them the paperwork, but if they have questions about what's on the paperwork, it's your responsibility to answer their questions. I have never seen this paperwork before. This is a brand new vaccine. So it was kind of unfair to us as the staff helping in the clinic, you know, that they didn't want anyone to ask them any questions. And this was already a sticky situation in the first place. But since we already had the staff there and encouraged them to get the vaccine, and the residents, they were already convinced that they would get them. But if they hadn't been convinced, they would have just walked out and not got the vaccine.
Wow. Well, thank you so much for being there and able to help. Now, on did you have 2 or 3 clinics?
We had 3 clinics.
Was it better on the third clinic, during the third clinic?
The third clinic was okay because it was only like a few people. So the major clinics was the first clinic and the second clinic. So the first clinic,
That's when most of the residents got it and some of the staff. The second clinic, most of the residents were getting their second shot, and the staff was getting their second shot. And then some people who were undecided, they got their first shot, which was great. So when it came to the third clinic, it was not many people because most people were just getting their second shot who had got their first shot at the second clinic. And I did make several announcements. I was trying to encourage people to come. But even they discouraged those people who was going to get their first shot, saying that they had to get their second shot somewhere else. And I'm like, well, don't tell them that, because I can explain that to them, that they're going to have to go somewhere else. You guys are not coming back. I understand that, but we need to try to get them vaccinated, period. So some people got like a little bit discouraged with their attitude that, oh, we can give it to you, but we not coming back to give you the second one. Which I had information for them to get the second shot. So, but that was real discouraging how their responses was.
Okay. Thank you so much. Thank you so much. Did anyone have any questions that they wanted to put in the chat, or you want to open up your mic? Any questions for the panelists?
At this time, we don't have any questions in chat, Yvonne.
All right. And we'll go to the next question. So the next question, Ms. Fuller, is what concerns have been expressed from the staff about the vaccine? For staff refusing the vaccine, are there different processes or expectations in place? And have you had to manage call-ins from staff who may have experienced side effects from receiving the vaccination, or they have contracted COVID-19?
Well, the concerns about the vaccine is what I spoke about earlier in what staff, mainly it's really education, and it has to be continuous education. Some of the problems lie in, again, when you play with social media, or you're sitting watching the news all day, and is it changing this, is it stopping that? And people have, they don't understand that if the side effects, if one or two people get it or whatever it is, now it becomes a side effect. It's not everybody, it's not the majority, and somebody has to really, begin to explain really what that is. And we're not in everyone's home to explain it. That they don't come to work and say, hey, I heard on the news, blah, blah, blah. You have to kind of pull that information out to say, well, why don't you want to take it? And then you can begin to explain. We do have more people, again, encouraged about the J&J, which we have in-house. We don't have to have anybody come here as far as an outside entity. This company, has its own pharmacy, so they'll come in and they'll provide the J&J vaccine. We haven't had that many questions actually on the J&J. I'm surprised about that, but we're prepared and ready to answer what those questions are. As far as staff and their side effects and whatnot and call-ins, again, we have been, I should say, since, let's say when COVID started in, we all knew about it in, March or February of 2020. Those numbers of call-ins have definitely decreased. So we don't have call-ins like that. We have a whole nother problem with decrease in our dire need of nurses and seniors. And that's based on other factors. That's where we're at kind of now. As far as if someone gets COVID, they're allowed to have that time off. Of course, they don't return to work until actually we work with the city health department, and actually they give us the day. We'll say 14, they might say 17 days. We do start with date. Did I do that?
No.
Oh, okay. We do start with, say, if you were positive today, okay, good, but no, asymptomatic. But by Saturday, you hit symptoms. So we do the 14 days starting from that day. And we do check on them, periodically just to see how they're doing and whatnot. But they do get paid at least 14 days if they're off. with a positive test. And you hit my question. I think I've answered it. Unless you have something additional that I might have missed, did I?
Well, you said what was going through my mind is you have J&J, and they're still willing to take J&J, although the media may.
Right.
So, but they're.
So I'm thinking, I haven't been hit with those barrage of questions yet. It's 6 people. It's 6. It can take 6 vaccines per vial. We already have 6. So it's ready to go, and that includes, I think it's 3 staff and 3 residents. And so with no questions asked, which is good. And one of those is actually, and she said, I can say it is my director of nursing. Yay. And so we're going to make that public so that everyone knows, okay, your director of nursing has taken the shot. Now we need to encourage our infection preventionists to take some type of shot. It doesn't have to be the J&J. But my main thing is, regardless if we offer the J&J or not, I don't care what you think, Pfizer, Moderna, whatever, whatever you're comfortable with. I just wish that, we had, how you have representatives come out for any other drug to sell you, to talk to you about, answer all the questions you want, feed your lunch, whatever, and nothing. There's no one coming out from that company, to say, hey, this is what it is, and they can answer, more questions than any of us do. And I think that's the big dilemma in all of this, outside of how rushed it was. And I understand that people ask for it, you get what you ask for, okay. But it doesn't mean that, that I don't have questions.
Thank you so much, Ms. Fuller. Thank you. Mr. Kirk.
So early on in getting the first few clinics, definitely number 1, number 2, the concerns that you hear is, they're going to track us with the vaccine. They're putting a chip in us. It's really water that you're putting in you. I mean, I've heard it all, and I'm sure everybody in this chat room has heard it all in regards to how did they make it so fast? You can't cure HIV, but you can cure this in a few months. So, I've heard about everything from the staff. And that was a lot of reasons people was refusing the vaccine because of the mass hysteria that they're hearing on Facebook, that they're seeing on Instagram, that they're seeing on the local news, site. A lot of people believe the misinformation instead of doing the research themselves. It blows me away the amount of people that just say, well, I heard it on the news, so it must be true. Or Google said it, so it must be true. And it's like, no, that doesn't mean it's true. You have to do the research yourself. So for us, once again, as I stated, when I took it, it kind of really helped them believe that, hey, this is true. This is something that's going to work. And it kind of helped downplay it here. But, you, as much as I try to convince people, they still go home to other people telling them it's water, it's a tracking device, it's things like that. So we can only do the best that we can. With the vaccines, I myself, as well as a couple other members of my team, did have some actual side effects from it. The first day, it was just general arm pain. The second day, I remember sleeping for about 12 hours. Because what this shot does is it triggers an immune response. That's what a vaccination does. So it triggers an immune response within yourself. So I slept for about 12 hours the second day. I had a slight headache relieved with basic 650 Tylenol, but I slept. Most of my staff, within day 1 or day 2, they've had that kind of tiredness or a nagging headache. I did have one staff member. He is my maintenance director. He was just out of it for about 3 or 4 days. He's an older gentleman with other comorbidities that we believe kind of played a factor into it. But he did not need to go to the hospital or anything like that. He just was extremely tired. For most of us, we saw these side effects after the first vaccination. We saw minimum side effects after the second vaccination. Most people said it was a mild headache that went away with Tylenol. As far as calling off, I think we only actually had one staff call off from the side effects of the shot. And that was just because we offered staff that if they called off, we would pay them. So he took advantage of, I got a headache, so I'm just not going to come in. Most everybody else was able to bring themselves into work and work. I do want to say another motivating factor that my organization did that was nice, and I didn't touch on this early, is if you took both series of the shot, you got 2 PTO days added to your bank. So that was also a motivating factor that helped people, to make that decision, because some people will do it for the 2 PTO days added to their bank. And that doesn't include the days off if, say, you had to call in because you had side effects or anything. No, you got 2 PTO days added to your bucket that you can use within a year because you took that vaccine. So I think it was important for our staff to have it. We did make a big deal out of the people who got the vaccine. I made a big deal. We have an app that we use called On Shift, and we just thanked them. We only picked the X amount of number of people who chose to help keep our facility safe. We thanked them in a text message. So overall, the concerns now, I think, are minimum. We don't have access to the shot yet, but we're slated to get it mid-month, and we're actually going to get the Moderna vaccine in-house. So we'll get a cooler in-house that we will utilize, and we will be able to issue that to any new residents, readmits, any staff, and we'll be able to give that to them. Side note, what's limiting us is the cost of it, because we don't own a pharmacy as Ms. Fuller's place does, so we have to buy it from CVS. And I know it's sad, but we're negotiating price so we can get this precious injections in our facility. But the price of a vial is very expensive, and if you've been through a clinic, if you don't use the whole vial, you got to throw it away. So it creates an issue when you got patients coming in that want it, and it's 10 injections in a vial, but you only got 7 patients. And with the cost of a vial being so expensive, it's very expensive. It's what do you do with that extra bit that you can't use?
Thank you. That was a good point about the cost of the vial. Thank you so much. Teresa.
I'm having the most technical issues. Okay.
Ms. Pettyway, are you able to see the question or?
I think it went away.
So it says, what concerns have been expressed from staff about the vaccine? And I know you probably get the most questions.
Just the threat from the government that they're trying to poison us about the vaccine, so they don't want to get it. And they have seen like people with some side effects or heard about people with some side effects. So they don't want to have any, nothing really concrete. It's just like the rumor mill type of things. But I just tell them, my husband took the vaccine and he did have the headache, for the first shot, the headache, and he had a slight fever. And I just gave him Tylenol. That was it. He wasn't unable to go to work or anything like that. The Tylenol brought the fever down, and he didn't have any side effects from the second shot. So I just kind of like share like the people that I know who had, both of the vaccines, which is like my parents, my siblings, my husband, and everybody's side effects were kind of the same if they had any at all, because everybody did not have any. So I just was trying to express that to them, that you may not have any at all. You don't know what a person's body, what kind of things that, you may be going through. You may be a perfectly. So I just tried to encourage them. But that was the main thing. Everything that they see on social media and Facebook, that Facebook is a powerful tool. Things on the news. So that's the majority of the staff concern about rumors. There's nothing concrete that they have. And when I gave them the concrete information, they felt better about knowing actual people. And I think it helped, but I just don't know. Also, at my husband's job, they got an incentive. I think it would have helped if we had an incentive. They got a $50 gift card if they were fully vaccinated and $25 if they got one shot. So that was encouraging to have incentives for the shots. That may seem menial because it's something so important, but incentives are very important to people. So I think that may have helped a little bit.
All right. All right. Thank you so much. I'm not going to have you answer the rest of the questions because that's more for, I think it's more toward the administrators. And since, so we're, Holly?
Yes.
You can take over from here. Unless anyone had any questions. I'm sorry. Were there any questions?
No questions in chat.
Hi there. I have a quick question. I'm just wondering, do you think more time is just needed for there to be more acceptance, or is there anything else that you can think of that would help people have a better idea of why they might want to get the vaccine? Is it time that's the big issue, or is there something else?
I think time is the biggest issue, because that's what most people say. I want to see what's going to happen to you. You know, they need that period of that study period just to see. You know, I think that's a huge factor, because as Demetrius mentioned earlier, you know, with all the rumor mills and whatnot, and it's going to do ABC to me, and they just created this vaccine out of nothing, you know. But if you study or investigate, you can find out it wasn't created out of osmosis, you know, and how, you know, some factors of it was already in process, you know. However, but, you know, a lot of that stuff is not given to people in a language that they understand. You know, sometimes we like to talk over people. You know, and instead of being direct and speaking in a language that they understand. That's communication. Communication is not talking over someone's head. And I think some of us, you know, might have even missed that mark, you know, and trying to break it down for people to understand. You know, some of those things are above me, and I have to ask questions. And we can't be upset when people have a question. Even if you have to repeat the answer, you might have to say it in a different way to get them to understand. But time, yes, that was the biggest factor.
Great question.
The time and the lack of information, just like Cassandra said, people really needed to ask their doctors. They needed to ask their nurse. They needed to ask someone. And because I feel like it was kind of a disservice because some of the doctor's offices are closed, you can only get telehealth. You can't go into your doctor's office and ask your doctor to his face, do you think I should get this vaccine? That's very important for some people. And most of the information that you get on Facebook is, I don't know who these people are in their opinions. They may not have gotten the vaccine at all or even read an article about it or anything. I actually did do some research on it. I do have a friend I went to college with that works for the CDC. So I did call her, you know, but everybody doesn't have all of these resources at their fingertips. So the people who do have the resources, I think it's our responsibility to make sure that we tell as many people the appropriate information as we can.
Thanks, Teresa. Great.
Thank you. And I just want to thank all of you. And just because of your decisions or your encouragement for others or educating them likely could have saved some lives. So thank you all for coming here and explaining all of that to us as well.
I do believe the decision to get the vaccine is saving lives, whether it be here in my facility, in my home life. So as I stated, I'm a licensed nurse, I'm an administrator, but I still work as a nurse as well, still moonlight. My wife's a teacher, So she's in and out of classrooms, and she teaches kids. As you know, they're not getting the vaccine. It's more of the older population, but they can be carriers and take it home to their families. Or, as you know, a lot of them go home to grandparents, so they can take it home to that population. And then my daughter goes to daycare, who, once again, it's a cluster of people. So me and my wife got vaccinated, so we are not sharing anything between each other or taking it to school, or I'm taking it to work and giving it to a patient at a hospital.
Fantastic. Thank you. Doesn't look like any additional questions are in chat at this point, and I'm not hearing any other questions from participants. Yvonne, can you give me a thumbs up if you could see the screen, resources and reminders? Fantastic, thank you. So Cassandra and Demetrius and Teresa, we can't thank you enough for being on this call today and sharing your perspective on COVID vaccination and, how you're working with your staff and your personal decisions. It's just been, very, very insightful. So we thank you so much for everything that you've talked about today. So now we're just going to move over just quickly to some resources and reminders. So we, unfortunately, we have to, get the vaccine adverse event reporting system up and running for anybody who has had an adverse event, certainly this information can be shared within the system. And then also healthcare professionals are required to report their adverse events to the vaccine adverse event reporting system. Vaccine manufacturers are also required to report all adverse events to theirs. So, essentially this information, being a consequence of a vaccine, that information is being shared and utilized and again, shared with various organizations as well. And also too, the Centers for Disease Control and Prevention have launched this vSafe, which is a smartphone based tool that sends a text messages. So looks like we got a question in chat here. And then also, based on the answers, the CDC might reach out directly to you to see how everything is going with that. And so, certainly if you have a chance to share that information or know of anybody who, can share that information, it is very valuable. Moving along as well here. So if you have any questions on where to get vaccinated as well, the CDC has a COVID vaccine finder that is available, and you can select that information based on your state or your territory and organizations that or facilities that are offering the vaccine as well. So if you know of anybody who is still continuing to look for a vaccine in their area, this might be a great resource to share. And then additionally for participants on the call, we do have some additional information for both for Michigan, Minnesota, and Wisconsin. There are some public hotlines that you can call to get additional information as well. And then also, too, notification. So Centers for Medicare and Medicaid Services is requesting skilled nursing facilities to enter vaccine data into NHSN. So even though it is not mandatory, there's a high probability that starting in October of this year that they will request this information. They're looking for healthcare personnel vaccination information and also resident vaccination data as well. And the reasoning for this is that it assists with identifying facilities with low vaccination rates so that vaccine uptake interventions can be provided. So again, that's not mandatory, but highly recommended at this point. Additionally, conferring rights to Superior Health. So Superior Health has hosted this event, and for the skilled nursing facilities that are currently working with us, we are requesting, again, not mandatory, voluntary, but we certainly would ask if you would be willing to confer rights to your NHSN access. This allows our team to really take a look at your infection surveillance data and support your organization with that performance improvement. So especially around CDI and then also with the COVID vaccination status as well. And then if you need instructions on sharing your NHSN data with Superior Health, we have included that link as well. And we are also here to answer any questions that you might have trying to link your organization up to superior health. Also, too, the organizational assessment. So we have sent out notifications to various individuals within your organization, whether it's a skilled nursing facility, hospital, or another facility type. What we have asked is if you could be so kind to fill out our organizational assessment. Again, it's voluntary, it's not mandatory, but this is through our data portal called Key Metrics. And so this information will help to guide our work and then really help you to identify any barriers or anything that your facility might need assistance with. So if you haven't received that notification to go into Key Metrics and to fill out that organizational assessment, certainly let us know. And again, we'll be more than happy to help you, navigate through that. Additionally, we have our email here, info@superiorhealthqa.org. If you have any questions about the assessment or conferring rights, or really just any question that you might have about today's event, or, if you need assistance with really navigating through the system here. So finally, again, if you want to reach out also directly to either Yvonne or myself, Holly, certainly we are here to answer any questions that you have. And we, continue to want to work with your organization and be able to provide events like this, like we did today. So we're going to conclude today's event. And again, I want to thank everybody for, assisting with, providing, that guidance on the COVID vaccination status. And again, thank you to, Demetrius and Teresa and Cassandra for your insight. So with that, I will conclude today's call. Thank you, everybody, and enjoy the rest of your day. Take care.